Hello everyone, welcome to our channel. My name is Zetu. I am a registered nurse. Today I would like us to talk about hydrocephalus in children. Hydrocephalus occurs in adults and it also occurs in children. But for today, our main focus will be hydrocephalus in children. What is hydrocephalus? Hydrocephalus is the condition that occurs if there is a built-up or excessive accumulation of cerebral spinal fluid which surround the brain and the spinal cord. This excess accumulation of fluid results in increased pressure in the brain. As a result, the brain tissue gets damaged. This condition needs to be treated because if it's left untreated, it can cause more complications like developmental, physical, and intellectual impairment. What is cerebral spinal fluid? Cerebral spinal fluid is the fluid that surrounds the brain and the spinal cord. This fluid is produced by the lateral ventricles of the brain and it gets absorbed in the blood stream. What is the function of the cerebral spinal fluid? 1. The function of the cerebral spinal fluid, it protects the brain from trauma. Therefore, it acts as a fluid buffer of the nervous system. Secondly, it supplies nutrients into the nervous system tissue. And thirdly, it removes the waste product from the brain. What are the causes of hydrocephalus then? 1 is blockage. If there is a blockage or obstruction in the flow of cerebral spinal fluid, that will result into accumulation that will lead into hydrocephalus. 2, poor absorption. If there is poor absorption of the cerebral spinal fluid, that will also result in accumulation. The cerebral spinal fluid is absorbed in the blood stream. And the third cause, if there is excessive production of cerebral spinal fluid by the ventricles, that will also lead into accumulation of fluid that will result into hydrocephalus. What are the underlying causes of hydrocephalus? Hydrocephalus can also occur before the child is born. And that type of hydrocephalus, we call it congenital hydrocephalus. What may be the causes of congenital hydrocephalus? 1, it can be genetic abnormalities that can lead into hydrocephalus. 2, it can be birth defects where the spinal column is not close, conditions like spina bifida. It can be infection that the mother must have contacted during pregnancy that can lead that the unborn child develop hydrocephalus. Infections like rubella or infections like syphilis. Hydrocephalus can also happen in infants, toddlers, and bigger children or older children. That type of hydrocephalus, where the child has been born without having this condition, but later or in early age the child developed, and that type of hydrocephalus, we call it acquired hydrocephalus, and it can develop on infants, toddlers, and older children. What may be the causes in this type of hydrocephalus, or what may be the causes that can lead for these children to develop hydrocephalus although they were not born with hydrocephalus? One, infection. If the child has had infection, things like meningitis. Trauma, especially injury into the head, the child may end up having hydrocephalus. There is quite a few of the conditions that can actually lead for the child to have hydrocephalus. Another cause, if the child is born prematurely, it does happen sometimes. There is some bleeding in the brain, and then once the child is born, and hydrocephalus can also develop. The tumors. The child can be born with a tumor all of a sudden when the child is born, and it develops. When they do investigation, they discovered that there is a tumor that the child has been born with. What are the signs and symptoms of hydrocephalus? One of the most prominent signs is the abnormal enlargement of the head. 2, the bulging of the fontanelle. The child may be very irritable. The child may be having a high pitch cry. The child may develop seizures. The child may not be taking feeds well, and quite a lot of them that can happen. Another sign for the bigger children, you'll find that there is poor performance at school if the child is already at school. And if the child has been able to go to the toilet, you'll find that child there is incontinence that happen. There will be some facial structures changes. All those signs, as a parent or as a mother, they need to be noted, because it means there is something that is wrong with the child. If you are involved into that child's life, it's so important that once you notice these signs that may be symptoms of hydrocephalus, to seek for medical attention immediately. The child needs to be taken into the hospital where he will be assessed and physical examination will be done so that they will be able to confirm the diagnosis if it is hydrocephalus. We will be dividing this talk for today into 2 sessions. Today's session, we call it part 1, where we've been discussing the definition of hydrocephalus, the causes of hydrocephalus, and the signs and symptoms of hydrocephalus. And on our next discussion, we'll be talking about the diagnosis of hydrocephalus, how the hydrocephalus is diagnosed in the hospital, and we'll also be talking about the treatment of hydrocephalus, as we mentioned that it is important that it needs to be treated because it may lead into more damage, and if it is left untreated, it can also be fatal. For today, we'll end up here, and then we'll continue with our next discussion next time. If you do like this short discussion, please comment, share, and subscribe. Thank you for love and support. Till next time, stay safe and stay healthy.